Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Nateglinide. Its brand name is Starlix. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, in this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Nateglinide. We'll then discuss examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Nateglinide lowers blood sugar by stimulating insulin release from the pancreas. This is dependent on the patient having functioning beta cells in the pancreas. Its action is caused by an interaction with ATP-sensitive potassium channels on pancreatic beta cells. In terms of indications or reasons we would prescribe this medication to a patient, we would often prescribe this medication in the treatment of type 2 diabetes mellitus. With respect to contraindications or reasons we would not be able to prescribe Nateglinide, well, we wouldn't give this medication to a patient who had a hypersensitivity to Nateglinide or to any other component of the formulation. This medication would not be used to treat type 1 diabetes, as this should be treated with insulin. As well, diabetic ketoacidosis should also be treated with insulin, so you wouldn't use Nateglinide in the situation. Now for dosing with Nateglinide, so in the treatment of type 2 diabetes, we would often see 120 milligrams orally 3 times daily, 1 to 30 minutes before meals. If a patient is near glycemic control, you may start with 60 milligrams orally 3 times daily. And with this medication, if a meal is skipped, you would skip the dose of Nateglinide. As with all medications, there are some side effects or adverse reactions that patients may experience while using Nateglinide, so I'll go over some of those here now. Diarrhea may happen 3% of the time, and 4% of patients may experience a backache. 3.5% may experience dizziness, and bronchitis may happen 3% of the time. 2.5% of patients may experience a cough. Influenza-like illness may happen 3.5% of the time, and an upper respiratory infection may happen 10.5% of the time. Now, one serious side effect with Nateglinide would be hypoglycemia, or low blood sugar. This may happen 1 to 3% of the time. Alright everybody, that's all we're going to talk about today with Nateglinide, or Starlix. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.